Good morning. Thank you for joining us for this COVID-19 update. Today is Tuesday, March 8th, 2022, and this is Kathy Turner, Director of Communications for the Louisville Metro Department of Public Health and Wellness. Mayor Fischer is our host today, and joining him are Dr. Sarah Beth Hartledge, Associate Medical Director for the Louisville Metro Department of Public Health and Wellness, Dr. Sarah Moyer, Director of the Louisville Metro Department of Public Health and Wellness, Delanor Manson, CEO of the Kentucky Nurses Association, and Amos Isaramana, Program Manager of Louisville Metro Office for Globalization. I'd like to remind everyone to please mute your devices and place your questions in the chat addressed to everyone. Mayor Fischer, I'll now turn it over to you.
Well, thank you, Kathy, and good morning, everybody. Today, we're going to look back on how our community has responded to COVID over the past 2 years, and we're hoping that this will be one of the last updates on COVID for a while, but this may not be the last call we're going to do on this, but we're getting close to that. So let's spend a little time to reflect back on where we have come from. I think it's fair to say on this date 2 years ago, our city changed forever when the dastardly virus came here. It was March 8th when that happened. And before March 8th, COVID-19 was, a threat. We'd certainly read about it. And it was a frightening disease that we could see at packed hospitals on the west as it moved toward here, first overseas and then on the west and the east coast. And then we watched the pandemic unfold on videos, empty streets with nothing but the sounds of sirens, and we heard it on the phone and the concern of voices of friends and relatives in affected communities. We just didn't know what was going to happen, was the short of it. Until we announced Louisville's first confirmed case on March 8th, 2020, the virus, was there and it was frightening, but it wasn't here. That changed. As you all know, improving health has been one of our city's core values since my administration started in 2011. And accordingly, our city was really fortunate to have a team of top-notch public health professionals who'd been through tough challenges in recent years, such as the response to the hepatitis A outbreak that happened in Louisville, which our public health team earned a gold standard response from the CDC, or approval from the CDC. So we're proud of them for that. Our public health team in my administration started preparing as soon as we heard about COVID-19, and it became clear that the virus could threaten the health and lives of Louisvillians very soon after the first reports out of Wuhan, China. So I think we were ready, as any community could be, in the face of a lot of unknowns. One case became many cases. Other people got to know people that had COVID. For me, COVID struck really close to home. My wife was one of the first people in the community to get COVID. She's a physician. She's tough. But for 13 days, it was really touch and go, and I was very, very concerned. Fortunately, she's got through that, and no ill after effects so far. Weeks after that, we marked the first loss of life in our community, the first of over 2,000 individuals now that the virus has taken from us in our city. Now, to learn and to get better and get stronger from this tragedy that we've all shared together as a community and as a world, it's useful to never forget the loss of lives and the fear amongst infected people and healthcare workers and the total exhaustion of everyone in our community, and especially our healthcare workers. And the pandemic caused certainly fear and concern, and it was frightening, but it also created amazing cooperation and compassion amongst us like we'd never seen before, because we hadn't had to pull together on something like this. So lots of innovation, lots of breakthroughs, resilience, and I think a new heightened appreciation and commitment to public health that was really reassuring to see how everybody came together. And I'm really hopeful that will endure past the pandemic. I'm thankful for our public health team's efforts to this point, along with a lot of other Metro employees. Not only did their work save lives, but consistent with our long health equity focus, they ensured from day one that equity would be front and center with every decision we made. And unlike many American cities, we have not seen a disproportionate impact on our communities of color with both infection and death here in Louisville. And that's a real testament to our health equity work and to our entire public health team. So I want a big shout out to Dr. Moyer and Connie, Dr. Hartledge, Connie Mendel, Dr. Hartledge, and all of our leaders and all of our workers at public health that have really produced these results under very challenging times. Now, at the beginning, we were focused on education and partnerships. Our healthcare systems set aside any type of natural rivalry they had between the healthcare systems and just did amazing work together along with our public health team and our administration. We created educational materials in dozens of languages. We started doing virtual briefings like the one we're doing right now. The doctor was on Saturday mornings, and town halls with experts to help keep residents as educated as possible. We set up a website and data dashboard with up-to-date guidance. And through Lift Up Louisville, we created an amazing city song. And we worked to help people remember that while our lives were disrupted and we were all staying at home, our community spirit was strong and we were still there together. So thank you to Margaret Brosco and her whole Lift Up Louisville team for doing all that for over a year. In the following weeks after that, tests became available, and we worked with partners to get tests available throughout the community, all parts of the community, mindful that as the numbers increased, we'd see disproportionate impacts amongst communities of color where poverty has been a generational challenge and health equity gaps have consistently been present. We overcame that challenge. Then our first breakthrough came, and that, of course, was vaccines. They are marvels of science, how quickly it came about. The mRNA science had been studied for quite some time, and it was the right science at the right time for a quick response. So built off decades of research, the first vaccines arrived in Louisville in the waning months of 2020. And then I've said it many times, our LUVAX operation at Broadbent Arena will go down as one of our city's greatest success stories when this whole episode is looked back on years from now. Yes, it was a really entrepreneurial public health response. Dr. Hartledge led that. Thank you, Dr. Hartledge. It was hard work and entrepreneurship. It wasn't magic, just a lot of hard work and innovation from your Metro team and immense compassion from the thousands of volunteers that love volunteering there. That was such a positive vibe when you went to LUVAX of people that were just happy to help other people. We created our Louisville Vaccine Task Force to make sure that everybody in the community, from our healthcare systems, our scientists, our business community, was all talking about what we should be doing. Dr. Hartledge was one of the co-chairs, along with Bill Altman, a great citizen that's helped us as a special advisor throughout this whole COVID period. So I want to thank them as the co-chairs of the task force, along with all the task force members and LUVAX volunteers. Delnor Manson is with us on this call. She was on the task force. Thank you again, Delnor. And then through LUVAX and LUVAX mobile mission, so taking LUVAX into the community, our team and partners have now provided over 126,000 doses of the life-saving vaccine. And it was a year ago when we really felt relief from this pandemic. That's when it started, and that was because of the vaccine. So, of course, COVID-19 is unlike anything that we've seen in our lifetime, but it was the 2021 spring and summer months of interacting in kind of what we thought was near normalcy that we said, okay, well, maybe we're beyond the virus. Well, the virus obviously had different plans. So the variants, so it was first the Delta variant, and then Omicron came and led to some of the most concerning numbers we've seen in terms of hospitalization and then deaths as well. So the difference of the last year, 2021, as opposed to the first year in 2020, is that we could do something highly effective to protect ourselves. And that, of course, was the vaccines. So I'm thankful to report that on this, the second anniversary of our city's first confirmed COVID-19 case, the virus is now in significant decline. So that's extraordinarily good news for us here in Louisville and all around the country. I'll throw a but in there. However, as we've learned these past 2 years, we've got to stay humbled to this virus because we didn't think it was going to come back a year ago, but it did. Now, a lot more people are vaccinated right now, but this virus is tricky, and its job is to make us sick and obviously kill us as well. So we've got to always make sure that we know there's a possibility of new variances and outbreaks and surges as well. So, smartest step, that we can take now is just be up to date on our COVID-19 vaccines. We know they're safe and very effective. It's irrefutable. The science is good on that. So please just get the shot if you haven't gotten the shot so far. It's never too late, and it's never not a good idea to get it. And while our numbers are dropping right now, we still have dozens of people hospitalized with the virus. And once infected, the risk of seriously harmful outcomes for the unvaccinated, they're unchanged. So there's just no downside in getting the shot. And we're still seeing new people get the shot every day, but I'd like to see those numbers higher if we possibly could so you can protect yourself and the people that you love. Vaccines are readily available now, as we've talked about, over 100 locations throughout the community. And there's no dispute that they're a big reason why we're able to have a fully open economy, fully open schools, and no mask requirements in most settings. I know we were all looking forward to that day, and it has come. So let's pay tribute today to all the people locally and around the world who have made this progress possible, and let's protect that progress with vigilance. It is not guaranteed. So, with all that being said, big thanks again to the team. Let's now dive in to see what our current status is with the virus. Dr. Hartlich?
Okay, so let's take a look at the data dashboard this morning. You'll see some updates to the way the data is presented on the dashboard, which are in alignment with the new CDC guidance and their classification status that we discussed last week. So there's no more orange color. We just have the traditional stoplight here, the yellow, green, and red. And excitingly, we did move from the red into the yellow this week. We still have over 1,000 new cases confirmed last week, 1,128 in the last 7 days. And that gives us an average daily incidence of 21 cases per 100,000. You can see from the graph that the numbers have fallen off pretty precipitously since the Omicron wave began. We do have 54 newly reported deaths this week. And similar to what I reported last week, we have about five, a good handful of those are passed away within the last 7 days. The rest are generally within the Omicron wave, but sort of catch-up data from our hospital partners that have been overwhelmed with reporting for the past couple months with Omicron. So a little bit of data catch-up there. We do have our vaccine data here. It has not had any significant change. We have about 75% of the population that has received at least one dose, and we have 44.6% that is up to date who have had their booster. So you can see there's a pretty significant gap there. A couple 100,000 people who have gotten their first dose, but not gone all the way through to the boosters. And the booster dose, that third dose, is very important for the most effective immunity. So if you're in that gap, it's not too late to go out and get your booster as well. And then the hospitalization trends, CDC's new guidance in terms of community COVID activities is significantly based on hospitalization numbers. So here you see 9.3 new COVID admissions per 100,000. That's a new piece of data that we're reporting, but it's based on the same information. So we have 7% of our inpatient beds are our staffed inpatient beds are occupied, which means we're in the green. We're not seeing a huge burden on the hospital system at this point. But as Mayor Fischer mentioned, we do still have, dozens of people who are hospitalized and still dealing with the effects of the disease. The hospitalization, ICU, and ventilator numbers are all falling, and our positivity rate is coming down as well. So all the indicators are that we are continuing on the downward trend with the Omicron variant, and hopefully we can have a quiet period here before any additional waves may come our way.
How about just quiet? Not a period, like quiet now for from here on. I'm up
That
for that.
sounds wonderful.
Okay. Well, let's talk about that a little bit, Dr. Hartledge. When 2 years ago, when we heard the first case, could you have imagined Louvax and Louvax Mobile, and that we'd still be talking about this 2 years later? What are your thoughts on that?
Yeah, when they named it when they named it COVID-19, I don't think they anticipated that we would be having COVID-22, but here we are. I think it's been really, if you can separate the emotions from it, it's very interesting on a science scale, watching these things develop in real time and seeing the amazing work that's been done by so many people. But at the same time, there's so many people who have had heartbreaking impact from this virus across the board.
Yeah. And then talk about your entrepreneurship and helping get this up and running, and the kind of challenges that you had getting 3,000 volunteers and more than 100,000 vaccinations at Louvax. I mean, looking back on it, what are your big takeaways?
The big takeaway for me is that we were able to see what talented people can do when they are empowered to do good work. So I had an amazing team around me who took poorly conceptualized things and made them into reality on a daily basis. We worked with some 3,000 volunteers, and at Louvax, we trained our entire workforce every 4 hours. We turned them all over 3 times a day. So it was a monumental undertaking, and it honestly was a huge amount of work, but it was also a huge amount of fun. I think you mentioned the atmosphere there was good, and people were happy. It was just it was a privilege to do that work and to be a part of it, and I'll treasure that forever.
Yeah, it was a great self-selected group of volunteers that were just wanted to help people. And it's really was a beautiful and purely joyful kind of gathering. And it was amazing when you saw people get their vaccinations in the lines at Louvax, and many people breaking down in tears. They were just so relieved to kind of feel like, okay, I'm not going to get sick or possibly die now. So I think we can't ever forget just the joy that you all helped produce through this wonderful public health response that you had. So when you're having a tough day, sometimes please think back on what a difference you and your team made in the community and continue to make in the community. But I think the main lesson we learned from that is do it, right? I mean, act. We didn't have all the answers, but we acted and then we improved. And your all's improvement cycle was just amazing there. And that's why Louvax was a great national story. So really want to again say thank you to the great job.
Thank you.
Let's bring in Dr. Moyer. Dr. Moyer is our city's chief health strategist and director of Louisville Metro Public Health and Wellness. I can remember those early days and many of the conversations we had very well. And I don't know that this was like anything that anybody signed up for, either when they were saying, well, I'm going to be the public health director or anywhere within public health. But you and your team really rose to the occasion in a really significant way. So, and I know amongst your colleagues around the country, you're very well respected for the work that you've led here in Louisville. So I want to thank you again publicly for the wonderful job that you've done. So here we are 2 years later. I remember that Sunday night, us getting together and saying, okay, it's here. Now let's prepare as a city. What are some of your big takeaways from these past 2 years?
Thanks, Mayor. I am with you right there. I mean, it seems like 10 years ago almost that we were in that room with all the media announcing our first case. And so much we've learned since that point in time. As you mentioned, so many pivots based on little information and acting and changing and improving as we learn more about the virus, as we got more resources, as we figured out how to fight better and stronger. So thank you and for the team for believing in science and thinking on logic. It's really helped us kind of accomplish what we needed to here in public health. I think the big thing that we learned is that when we do come together as a community in our collaborations and our partnerships and with the resources that we can achieve health equity, we can accomplish our mission that we have here at the health department. And we've learned so much and how things work, whether it's being able to provide housing and resources, being able to go out to people to get them vaccinated. All that has really helped us accomplish our goals here at the health department. And I'm hopeful that maybe we can continue on that as we tackle so many other public health issues that we have in our community to keep that momentum going.
Yeah, we've talked about our population health issues. We still got a lot of disparities and gaps between the majority and minority populations. That the same type of collaboration that we've had from all of our health care partners on the vaccine task force, so we can extend that on into these other challenges. Some amazing things could happen for us. So I know we're all hopeful that indeed will be the case. On that health equity aspect, how do you explain how well we've done in the community relative to no disproportionality of infections and death with our communities of color compared to most of the rest of the big cities in the country?
Well, one, it's in our mission as our health department. It's something that we've been working on since we changed it back in 2017, and even since we started one of the country's first center for health equity, the first one in government back in 2006. So it's been on the forefront of everything we've done as a health department for many years. And so I think taking those lessons learned, as we learned with hepatitis A and other issues, and those partnerships that we've had over the last 20 years really helped us know what to do. And with COVID, we were uniquely had the resources to do it. And so that really helped. I think it also, we benefited from getting hit later in the pandemic and learning from others across the community and taking those lessons learned and being able to implement them here through our strong teams. I can't thank our public health team enough for everything that they've done over the last years to make sure that that stays at the forefront of everything that we do and continue to improve on.
Any other thoughts you'd like to share?
I mean, so much. I thank the community for, I guess, tuning in every week and watching me grow as a communicator. It's been great to have that experience as well, too. And then for the team that we have in public health, they don't get enough credit as I get to be on here every week. And so just really thankful to Connie Mendel, who led our COVID response and her whole team underneath there. I think you've got some of the big players on the call that are always here, be able to answer questions if I don't know the answer. And so thank you to Connie and to Nick and to Karen, Kathy and Kristen and Catalina, I'm looking at the names. Dr. Acopo, we've got a really fantastic team in public health and wellness, and so just grateful for all their leadership. And Dr. Hollers, you mentioned her, so I didn't say her first, but leading our COVID vaccine efforts, it's been huge for everything we've done for the community. So thank you, everyone.
Well deserved. And I don't think Bill Altman is on the call, but why don't you talk about, and Bill, if you are, pipe up, please, but why don't you talk a little bit about the role that Bill played and how he came into the scene and how he really it was an extraordinary contributor for us both locally, but then in the national work that we're privileged to be a part of with the Rockefeller Foundation, the CDC, and other groups.
Yeah, so grateful that Bill stepped up to contribute to the team. He's a past chair of our Board of Health, and so knew our systems more than other outsiders, and it really had the connections to our corporate community. And as you mentioned, Rockefeller and other foundations to help get more resources to town. Really has a great facilitator skill set and bringing people together and just making sure we're thinking about ways to communicate with other groups that we maybe weren't used to communicating. And so I can't thank Bill enough as well. Him and Dr. Hartledge led that COVID task force that we appointed. And it's been great having those community members really helping guide our work here at the health department.
So Bill Altman, just for the media, is a retired senior vice president at Kindred Healthcare. I've known Bill for quite some time. And as we got into this challenge, we just needed more resources to help. And we connected with Bill, who said he'd be happy to help. And he's led a lot of our efforts here and just really appreciate. So it shows what a great citizen does. So hats off to Bill Altman and all of our team once again. big part of that team has been the Kentucky Nurses Association. I brag on them every opportunity I get because we would not have been able to administer nearly the amount of vaccines that we did if KNA did not step up. And I think one of the big reasons why KNA stepped up was they've got a tremendous leader in Delnor Manson who embodies compassion and service and taking care of people through health and belief in science and just good old-fashioned hard work as well. So Delnor, thank you so much for joining us here today. How do you evaluate all this and what makes our city's partnership so unique with the Kentucky Nurses Association?
Well, thank you, Mr. Mayor. I'm glad to be here, and I'm glad to be part of this incredible team. And what makes us special as a city is, as I've heard others talk about, is the collaboration. And I'd like to give a shout out to Bill Altman too, because it was Bill who made the call, who said, we need nurses, what you got? And I said, we've got 16,000, can we help? And he said, oh yeah. So between Bill and Ruth Carrico coming up with a way that the Nurses Association could provide support, we came to the table and we've stayed at the table. We've had people to come from all over Kentucky, though, to come to Louisville to help us to get the job done. And that's one of the things about being a statewide organization. When you put the call out for help, you never can tell who will show up. And the Kentucky Nurses Association definitely did show up. We appreciated being involved in the LUVACs as well, where we had a tremendous amount of volunteers, nurses, and others people who support nurses who came out. But also nursing students. We have nursing schools in the area, and we help to coordinate nursing students to come to LUVAC so that they could have clinical experience. And it was just incredible for them. It's not something that I thought we would be doing, is coordinating nursing clinical rotations for nursing students, but it seemed to help out at LUVACs, and it certainly helped out the nursing students and the nursing schools to have a place where they could go.
Yeah, that's great to see them, and then U of L Medical School students as well. And we talked to them, Delnor, you and I both, just saying this is an amazing experience to have as a young healthcare professional. What it's going to prepare you for the rest of your career, and what you think you can work through, and the challenges that you overcome when you face something like this, no matter what your age, but especially helpful at a young age. And it's amazing too, because we read about all the nursing shortages that are around the country, and certainly in our community to some degree as well. So to see all this happen amongst a nursing shortage, I mean, how do you explain that?
Proudly, because we had nurses who came out of retirement to help us at the clinics, who are still helping us at the mobile missions, but they came to LUVACs, and we had people who went to work and worked a 12-hour shift, and they came out to LUVACs and worked another 4 hours because they knew the community needed them. And those are the types of things that nurses do. We had nurses drive in from Lexington after they had worked their shifts to come and work at LUVACs, or were up all night and drove to Louisville to help out at LUVACs. Nursing shortage, yes, but community had a need, and the nurses came to assist in resolving that need.
Yeah,
That's how I explain it.
yeah, amazing, and lots of gratitude. Do you have any idea how many testing and vaccine clinics that KNA has helped run?
Well, if we don't count LUVACs, if we just do mobile missions, we have provided over 17,000 tests and vaccinations. And that's a small group of team leaders that we have that we've trained and keep going, keep showing up. So we've done over 600 missions, and let's see, 9,918 tests. We did one of the first drive-through testing events at Hope Wellness in the West End. And at that time, all we had was the PCR. Now you got to get this site. We have 40 students from Galen, their instructors, because everybody wanted to participate. And then we had our team leaders. So we had about 50 people out there, and we gave flu vaccines, and we did PCR tests, mobile PCR tests. It was just incredible. But because of our relationship with the nursing schools, especially with Galen, we've been able to do some tremendous things.
Yeah, no, it's been a lot of win-win. Now, last question, you're also a member of the Louisville Metro COVID-19 Vaccination Distribution Task Force. So can you talk about why it was important to have that task force?
Well, from day one, I was very impressed with the priority on health equity in how we were going to deliver the vaccines, and we were going to make sure that they were going to be accessible to everyone. And I think that if we had not had a task force that had the collaboration with all the healthcare systems, with epidemiologists, the health department, nurses, we may not have made the strides that we made in the short period of time. And it seems like it took us a long time, but in reality, when you think about what was accomplished with that vaccine task force and with the health department, we moved at lightning speed. And that's why when 60 Minutes came to Louisville to talk about the success, even though they were really talking about the nursing shortage, they really focused on how the healthcare systems work together to address COVID issues and to address the nursing shortage.
Yeah, no, great job on that, and really led to our wonderful results with health equity as well. That's been the driver, as you said. So thank you, Delnor. Appreciate you and KNA. Keep it rolling.
We'll
All
do
right.
that, Mr. Mayor.
All right. So we also had a big focus on our immigrant community, a big part of our work here as well. I really appreciated so many leaders of our immigrant community stepping up at the beginning of this and helping us with the translation of materials. And it was also another kind of moment of joy during all of this challenge that you could see the folks that participated just embrace their role as U.S. citizens, saying, okay, this is what I've heard about what America is, how people stand up to help each other. And given their unique skills that they had with translation and knowing their communities, they just happily created materials and executed on our needs. And I'll just be forever grateful for that. Amos Israimana was in the middle of all of this as our program manager for the Office for Globalization. So Amos, thank you for your leadership and bringing so many people on board to help us with this challenge that we had. So talk a little bit about that, about the biggest challenges and communication barriers that we saw at the start of the pandemic.
Thank you, Mayor. And you hit there on a nail there with communication. I think everybody here can agree that communication was key from the beginning when the pandemic started. And so specifically, not only getting information to folks, but also making sure that it was the correct information and that it was accessible to everyone. And so, at the onset, we translated a lot of the information that we were receiving, updated from the public health department into 26 languages. And as you know, that's only a fraction of the number of languages spoken in Louisville. We have over 154 spoken in Louisville here. And so it was critical to be able to get that information to those who are limited English proficient individuals. However, we also saw that, just translating information was not enough. And we needed to be able to get to communities and make sure that they are receiving the information the best way possible. And so we really had to be creative in terms of reaching various social media groups and sites such as WhatsApp and Facebook groups where many of these communities convene and share information and make sure that especially those who are unable to read even in their own language were also receiving information. And so we had to really be creative in using the various platforms available to us so that the international community also has access to the same information that everyone else was getting.
So talk about communication and trust. I mean, it seems like we've done a really nice job in that through our Office for Globalization, many partners. When I've attended some of our clinics that have focused on our foreign-born communities, we've had really good turnouts. What do you attribute that to?
Well, one thing I think that we could attribute that to is the infrastructure we built with the office and with the Louisville Welcome Academy, our leadership program that we've had for the past almost 5 years. We've had over 100 graduates of the program so far, and those alumni were key in being able to reach the various communities. And so we started a community ambassadors program at the onset of the pandemic. And these were folks who were alumni of the Welcome Academy, or were also influencers in their various communities. And so they stepped up really to um, reach the communities where they are, going into to churches or to community meetings or even neighborhoods and immigrant dense apartment complexes to be able uh, to reach folks. And so, as you've seen, a lot of the both testing and vaccination events that we've hosted in the community, they were always there to provide not only translation and interpretation services, but also to really ease the hesitation that folks had in terms of the information they were getting. Um, and share that they could trust the tests, they could trust the vaccines, and that they could trust government. And as you know, with everything that's going around the world, especially for our refugees that live in transition for a long time, they don't have that connection with government. They don't have that trust for government because they're running away from um, acts done by government. And so it was really important to build that trust through the community ambassadors.
Yeah, no, great job on that. And then we've had some amazing institutions here already, like Americana Community Center, La Casita, and others that had built trust before. And when people go there, they see people that they recognize that speak the same language. And I heard that time and time again when I'd asked our members of our foreign-born community what brought them to the vaccine clinic. So Amos, to you and the team, great job on that. And just a closing comment from you on any key takeaways or lessons learned that we should continue even after the pandemic is over.
Thank you, Mayor. I think to echo what everyone really has said, Delano and Dr. Moyer, the collaboration that really that was born out of this pandemic was key, and I think that's going to continue in order to be ready for another pandemic if we were to get one. And I think strengthening those relationships really was helpful to be able to address other issues out of those collaborations where we've been working with other metro agencies to address other health issues such as substance abuse or even suicide prevention with the Center for Health Equity. And that's really been a key takeaway for the Office for Globalization and in continuing to connect our various communities with metro agencies and our nonprofits who are doing great work around the city.
Okay, thank you. I most appreciate you and the entire team.
Thank you, Mayor.
Okay, Kathy, we'll throw it back to you for immediate questions.
Okay, we do have a few questions in the chat. Our first one is from Tara Bassett with the 502 live streamers. Fully vaccinated and boosted, otherwise healthy folks are still dying, like our beloved Wayne Perky, and masks are now largely absent, social distancing a thing of the past. What's the forecast for another potential variant catching us with our guard down in a few months? Dr. Hartledge, can you address that?
Yeah. So even if the numbers are small, if the percentages are small, people are still being impacted by this virus. People are still being hospitalized, still having long-term effects, long-term disability, and of course, we have fatalities from this virus as well. So it's easy to think that this is all over, and it's really tempting to think that we won't have to think about COVID anymore, but we really know that that's not the case. There's no other so-called variants of concern specifically on the horizon right now, but until we achieve global vaccine equity, we are likely to see additional variants develop at some point. How it's not a question of if, it's a question of when. And the situation in Europe right now with 1 million refugees coming out of Ukraine, which is one of the least vaccinated countries in Europe, certainly highlights the need for global vaccine equity so that we can prevent the development of additional variants because they will impact us all, whether we like it or not.
Thanks, Dr. Hartledge. And I'll also ask you this question from Deb Yetter. What's your best advice on masks in public around Louisville? It appears a lot of people have abandoned them, and Tara noted that as well. So what's your best advice on masks in public?
So first of all, anyone, regardless of risk factors, can still choose to wear a mask if you feel most comfortable and safest doing that. Whether you're vaccinated or not, that is something that you can choose to do, and hopefully your workplace and the people in your social circle would support you in making that choice. With that said, we've moved from the red high transmission to the yellow medium COVID activity level. And with that, the CDC recommendations say that masking is not required for all people. Folks who are at high risk are still urged to mask regardless of their vaccination status. And I would just emphasize that there are many more people who are high risk than perhaps they realize. Essentially, any medical condition, common things like asthma, high cholesterol can all play into being a high risk. And, you know, if you're a current or former smoker, that can list you at, it can make you a high risk. And same for your weight. So overweight or obese, which means if your BMI is 25 or up, you are considered on the high risk list, which is a large number of adults. So all of those people really should be continuing to mask. It's not going to be required by most institutions at this point. So it's going to be on you to make that decision.
Okay, thank you. And I see we have another question from April Rickard of WFPL, but I want to catch Paul Miles because he's piggybacking on Deb's question and you've sort of answered it, but he's asking, what does moving into the yellow status and the CDC's medium community level mean for us? Does it mean we can go about our pre-pandemic business? Or I think you've suggested, but what are there precautions that we should still take?
So regardless of what level we're at in CDC's new classification, the first recommendation for everyone is to remain up to date with your vaccination. So if you're age 5 to 11, that means getting 2 doses. And if you're over 12, it means getting your booster. So that's the first recommendation. The other thing that I would really emphasize is we've learned throughout the pandemic that it's super important to stay home when you're sick. If you have a fever, if you have a cough, if you are sick, please don't take it to work or school with you. Whereas maybe you would have powered through that in the past, we really would encourage you to stay home and avoid spreading that. So if you know you've been exposed or if you have symptoms, all those recommendations about testing, isolating, staying home are still in force. We talked about the masks a little bit, and we do, but the simple things still apply. So stay home if you're sick, get your vaccine, and just keep aware of the information because we may go back into the red at some point and need to be all wearing our masks again or making other steps.
Thank you. And it looks like our last question is from April Rickert with WFPL. Dr. Moyer, how will the partnerships and collaborations formed during COVID continue to address other health issues in the community?
Great question. So partnerships has always been one of the 5 core tenets in public health. We have a whole group that works on community engagement and strategic partnerships. And you've probably seen it around with our Healthy Babies Louisville coalition that works at infant mortality, our substance use disorder coalition that was really trying to tackle the opioid epidemic. And so those have grown. I think the great thing about the pandemic was it was so fast moving that it really highlighted kind of gaps that we had in our partnerships at the health department. And so we formed great relationships with AMIS and the Office of Globalization and the Nurses Association, because we do not have the nurses we used to have in our health department, and so are not able to respond like we could 50 years ago. And so all those was great to learn and know and build those, and hoping to keep those going forward to use all those new resources, new partnerships that we've gained these last 2 years to tackle all those other issues. And so just hoping to keep adding to the team here in public health.
Thank you. And we do have one more question from Paul Miles. Dr. Hartledge, even with case counts in decline, do you foresee additional boosters in the future?
I don't see it in the near future. I don't see a fourth dose in that series for most adults, but I do think that it will be something that we see eventually. Eventually we will come to sort of a steady state where perhaps it's like flu, where we need an annual update. Perhaps it's like tetanus, where it's 5 or 7 years. So it remains to be seen what that timeline looks like, but eventually I think we will reach a steady state where adults will be recommended for updated immunization on some regular schedule, but hopefully not anytime soon.
Thank you, Mayor. That was our last question.
Thanks to the media for continuing to report all this and keep our city informed. And I know we all deal primarily with challenges during the course of our days, but it's nice to be able to look back on 2 years and say it was a very challenging time for us. Some challenges still remain, obviously, but it's also good to recognize just the tremendous progress that has been made with COVID in our community and all the wonderful people that rose to the occasion to help so many other people. So I couldn't be more grateful for the wonderful community, the big family we have here in Louisville, and how it came together during this extraordinarily historic time of public health challenges and really rose to the moment to beat the virus back. So again, big thanks to everybody, including the media, for all the coverage here. And we'll look forward to seeing you all again soon. Thank you.